So there are many different, we don't like to call them techniques, because we don't learn techniques. It's a medical practice based on philosophy, right? So the philosophy, the foundations of it. But the practices that we use, some are very biomechanical. So some people are very, very biomechanical, and like that's how they focus on articulations, they focus on the muscles and the bones and the connective tissue, right? From a biomechanical. All the way to the spectrum on the other end is the more biodynamic side. So in order, and there's everything in the range in between there. So myofascial release, visceral techniques, somatic release, osteopathy in the cranial field, using ligaments in a balanced way to treat. These are all different modalities within osteopathy. And as I said, there's only 2% of us who do this. So our patient population needs more than that. So that's why, like, the community approach, right? Like, we're all working on aspects of health and healing, right? So all of this is maybe the foundation, but we're all working together in our various aspects of health and healing for the body. So other things, when I write my recommendations for patients, I typically break them down into these categories because I found that to be the most resonant with how I see with my practice of osteopathy, and it's accessible to patients. So I'm looking at the nervous system, looking at autonomics. Again, that patient who walks in the door and they're like this, and they lie down on the table, but sometimes they're not even on the table, right? Their body may be on there, but you can tell that they're holding their entire body up. So what is initially that saying, right? That they're autonomics. How many people find people in such sympathetic overdrive, right? Fight or flight. Whether you're just, whether you don't even put your hands on the patient, you can tell that there's, oh my gosh, not even from the past 4 years, but from birth onward, right? The nervous system, I tell patients all the time, our gut sense is real. Like, our nervous systems are really smart. Our nervous systems gather information long before our conscious mind accepts it, right? So listening to that and trusting that, what is that? So there's a lot of things that we can do to help regulate the nervous system, right? To help bring that nervous system into balance. Breathing is key. Breathing being key from a biomechanical standpoint. I teach most of my patients a breathing technique that I actually learned in hypnosis that allows the biodynamics of the breath to affect the nervous system in a way that creates calm. And I heard a number of you say that you love to teach your patients and clients things. It's absolutely my goal. My goal is to make it so that patients don't need me. Empowering the patient is so huge, right? Like, don't you love it when you get that light bulb going off and they're like, oh my gosh, that makes so much sense. No one ever told me that before. Wow, yes, it's your body. Let's use it. Let's learn how we can use it, right? So lymphatics and detox, whether you're doing IV glutathione, which is a great detoxification strategy, whether you're doing lymphatic massage, our lymphatics are throughout our entire body. I love telling people that the osteopathic world has been talking about the motion of the head, and there's a motion, the lymphatic system in the brain, right? It wasn't until fairly recently, I'm blanking on the actual date that the article came out, that the lymphatics were discovered, right? We finally could see scientifically with imaging a lymphatic system of the brain. Well, those of us who work with the body have felt the motion in the body, right? We just didn't have a name for it. Sutherland, the founder of osteopathy in the cranial field, he's the one who described it in the 1950s. There is motion. fMRI imaging has shown that the bones of the head move. Well, isn't that interesting, right? When the bones don't seal together, right? They're not solid. The bones of the head move. And what is the origin of that motion? Well, now, finally, we have technology that is able to show, oh, wow, the brain's moving, the head's moving, the whole body is respiring. How cool is that? The technology finally caught up to what we've been doing with our hands. It's really fun stuff. That leads us to the biomechanics, right? So I take my role as physician, as teacher, very seriously. I love teaching patients about how their biomechanics actually affect their nervous system, affect their lymph, affect their cognition, affect everything, and what they can do with that. So, any questions? I obviously can talk for a long time about this stuff, and I enjoy it so much. So one of the things that osteopathy in particular offers is this foundational approach of how your physicality influences your health. We put symptoms into context, and so what does that mean? So especially pulling in not only my osteopathic training, but my functional medicine training as well, putting the symptoms into context. Like when somebody's coughing or somebody has, a sore throat, or they have acid reflux, for example. How many people here work with the diaphragm? Yeah. How many times are people's diaphragms all stuck up, right? And then if you just think, like, this isn't magic, it's anatomy, right? So I tell people all the time, like, this is just anatomy, right? It's just applied anatomy, right? If the diaphragm's all stuck up, think about all the structures that go through the diaphragm, right? Or think about patients in a hospital bed, right? What is happening in terms of their motion? Even people sitting here, right? When you take a breath, how many people only breathe from here to here, right? And so we're like, oh wait, the diaphragm's supposed to move down, and then the abdominal diaphragm is supposed to move with the pelvic floor diaphragm. Who's a pelvic floor specialist, right? Exactly, right? These diaphragms move together, and guess what? You've got diaphragms behind your knees or popliteal, you've got diaphragms at the bottom of your feet, you've got 3 or 4 in your head, right? So in an ideal motion of the body, all the diaphragms are moving together, right? In a non-restricted way, all the motions of the diaphragms are moving together. And from that comes healing. Why is that significant? Look back at the lymphatics, right? Lymphatics don't have a heart. They don't have something there are various pumps in the head that move the lymphatics. I'm talking about from a big organ perspective. They don't have the heart pumping them. So lymphatics run in neurovascular bundles. And so one of the things that moves lymph is the motion of the diaphragm, right? Post-surgical consultation, right? Post-surgery, we think about where the body is in place and what happens to a body during surgery, right? You've got intubation, you've got stasis, you've got moving in various places, right? What are the things that we need to do to remove restrictions to allow the body, again, to heal when the restrictions are removed? So what does osteopathy treat? What does it sound like it treats? Everything, right? Right? From the philosophical standpoint to the actual standpoint. So it's just a list of like, what are some things, because we have to do ICD-10 codes, right? We have to like say, well, what is the medical reason that you're here, right? So these are just some of the things that when we put down, like, why is someone seeing me? My favorite thing since I've joined him is that I say, oh, why are you here for an osteopathic appointment? Dr. Teller said to do it. I'm like, okay. Thanks. All right, this is awesome. It's been a real fun journey because in the osteopathic world, like we talk amongst ourselves and we get it. And so being as part of PEM, I'm learning a whole new language of how to introduce these concepts to people who didn't seek us out. And that's fascinating. And it's fun, right? So a number of the things, pain, headaches, TMJ, love treating TMJ. But it's not just TMJ, right? It's not just the biomechanics of it. It's nervous system. So much nervous system associated with that. I'm really stressed, and I grind my teeth at night, right? How many of us hear those things, right? And the manifestations of stress, are reactions to stress. The manifestations are throughout the entire body, right? People experience it in very special ways, and a lot of times patients will say, I'm just really stressed, and or they come in and like, okay, I feel great now, but they're still sitting there like this. Right? Linda and I talk about this all the time. We're like, oh my gosh, okay, so they think that they're great and they've made improvement, but we as trained clinicians can be like, oh, okay. Or even from the energetic perspective, right? Somebody can walk in that room and we can be like, oh my goodness, the entire energy of this whole room shifted because of that, right? So we can affect each other It's not only our individual bodies, but it's affecting those around us. So, one thing that's really, really fun is to treat infants in utero. People do that. I'm right here treating pregnant patients, and then treating the infants. There's so much of a flow, because infants, I mean newborns especially, they're all fluid. They're all fluid. There's not a lot of, there's some biomechanics, but overall, they're fluid, and they're so fun to treat, right? So, IBS, constipation, stress, and anxiety. How many people know that stress and anxiety are associated with IBS, right? A known connection, right? So, you guys can on that. So, I think that brings to my question over. Thank you all for being an audience, and thank you for being receptive to osteopathy. I absolutely love sharing it in this healing space, and I'm open for questions. I brought some of my favorite books on the table back there. If you want to just peruse and just say, what is this? Now I need to share that with the combined medical education that happened a few years ago, MDs and DOs now have a combined residency program. So we used to do them completely separately. So now MDs are able to learn osteopathic techniques and practice. There are courses. So it's really kind of opened up, and the curiosity that has generated has been so fascinating and amazing. So thank you all. Thank you.